Our last session before our lunch break will be about medical risk assessment, which will be covered by Medaire. Speaking on behalf of Medaire will be Dr. Paulo Alves, Global Aviation Medical Director, and John Cauthen, Director of Security, Aviation and Maritime. Both Dr. Alves and John are joining us from Arizona in the US. Gentlemen, over to you.
Thank you very much. I hope you can see my screen at this point.
Yes, sir.
Perfect. So first of all, it's a real pleasure and an honor to be part of this most important conference. It's a really honor for us to be part of this. So we're going to talk a little bit about the health and safety aspects, risk aspects in the new normal, if we can call this normal at all. So in how things that we need to consider to restart operations at their full. So I can start by saying that this has been for the medical people, that everyone that I know, this has been a humbling experience, because COVID, everything that we believe, 5 minutes later, it's totally different. So we've been learning so much, and things have been changing in such a pace that is even difficult to follow. The reality, for example, is that if we look into what happened, is that the WHO announced the public health emergency of international concern around January 13th, and then a pandemic on March 11th. And and this feels like yesterday. And I remember I was actually in Beijing early January, and I was there knowing that the situation had already started in China, and I was absolutely confident that the situation was under control. There was around 600 cases by then, in the whole China at that point. So 10 months later, here we are at 56 million cases and 1 million deaths in this planet. And the situation is far from being in control in most countries. And second and third waves, or we can see them today. And countries are taking their actions, and some of them are going into lockdown again. So any initial relief that some countries had, they're not in the forecast anymore, at least the short term. And so we wait for new developments, the vaccine, and etc. And honestly, we are even witnessing today a global sense of COVID fatigue, because people are just tired and they just want to play something, something different. It took us, and keeping us even hostages as in our homes, just like I am right now. So I totally miss, traveling, and particularly traveling to, to the Asian region, where I like so much. So with all this taking place, how could we really restart our operations? I think that's the question that we need to answer. And just to give you some perspective, Medaire in International Westeros Group, of course we are not, although we've been always involved in the pandemics and pandemics planning, we didn't expect ourselves to have such an impact in our activity. We are extremely busy when we have assisted in thousands of cases. We've been performing COVID screenings and assisted in diagnostic tests, staffed medical professionals, every month to different organizations and in remote locations, for example, and helping people restart their activity. And we dealt in the airline business. We dealt with more than 2,000 COVID-related airline crew cases. So because they are traveling here and there, the cargo operation that was taking place, and we the branch of the activity involved in procurement, we have sourced PPEs for more than 15 million masks and PPEs that were delivered. It's really fascinating working here, if I may say so, because we have a very privileged window into what is going on there. I know this is a busy chart, but I think it gives us some idea of what I'm trying to say here. If you just look into this red line here, this is the median of cases that were the percentage of cases of suspected infectious disease in flight along the over the years from 2009. From 2009 to 2020. And what you can see here in the red line here, dotted line, is the median of all those years. And what you can see is that it is really easy to observe some seasonality. You see a peak here around January, December, and then a secondary peak around July, August. This corresponds to the winter times in the southern and northern hemisphere, associated with the flu normal outbreaks that that repeat every year in the same winter times, northern and southern hemisphere. But if you look into this dotted line now here, you're going to see that this is 2009, and what happened here was the pandemic of H1N1. So, and you can clearly see, how the anomaly that was presented, and more recently, you can see the anomaly represented by the pandemic of COVID-19. So, in-flight cases were suspected more often, of course, and this I think highlights the heightened alertness about COVID, and at the time in 2009 about H1N1. So those pandemics definitely make people more suspicious and more alert about other passengers, and so that they can detect those people while in flight. And there are even cases where one passenger will say, well, this person is coughing too much, so please, Mr. and Mrs. Flight Attendant, please contact your some medical advice. So this is the picture of how we see it in a regular, in our regular business. So, but that means that yes, most likely, this virus truly travels by air. We know that. And actually, if you look here, so that flying, if you look into the initial, the beginning of the outbreak. So this is Wuhan here, the city where, it was first described, in all the connections, connecting flights out of Wuhan. You can see that, the initial points of spread of the disease, they can almost be superimposed in this map of flight destinations to and from Wuhan. Not only on a regional basis, but also on an international basis. So we know that the virus, is a frequent flyer. It takes a ride with in the passengers, and passengers flying, via commercial or business jet or whatever. But we know that the virus is able to fly, and certainly air travel was a very strong means of the international spread of this disease. However, the impact, as you can see in the right-hand side of this slide, is not, it's not even. And you can identify a few patterns here. So if you look into, those are the G20 countries. So what's happening in China is totally different than what is happening, for example, in the United States, that has this trimodal curve so far. And I dare to say that you can identify a sort of an European pattern. So see Italy here, Germany here, France with an initial little, peak, and then a valley here, and another peak coming. And this is almost opposite what you see, for example, in Brazil or in the Southern Hemisphere. South Africa is the same, that you have a peak that it's actually the opposite of what is happening in Europe. So this might have to do with the temperatures and the weather, wintertime, summertime in the northern and southern hemisphere. And of course, the handling of this is also depending on the public health policies, which of course vary across the different countries. So it is a very complex scenario, if you will. So we know that the virus contributed to the air travel contributed to the spread of the virus. But actually, we know also that the chances for you to acquire this disease in flight seems to be very small. When you look, for example, in this little table here, it might be updated because we are aware of more publications on that. But IATA consolidated statistics on the number of cases that were a possibility of an in-flight spread of the virus. And out of 1.2 billion passengers, there was only 44, now probably 48 people that were suspected to having acquired this in the airplane. At the same time, we have all the clusters associated with business meeting in Singapore, in name it, in Germany, and elsewhere. Religious congregations and etc. And yet, when you look into the air travel, the chances of acquiring it in flight seems to be very small. And why so? Because yes, we know, that the systems, and this is from IATA, of course, referring to larger and heavy aircraft. But this is the same exactly system that we have in modern business aircraft, which is the recirculation, the ventilation systems. Thanks to the ECS system, we have a very high rate of ventilation and filtration of those systems. So, and this has been, confirmed by different studies showing that the exposure on planes is, in all those cases, I should say, were occurred when we didn't have the mandate for masks in every flight. So most of those cases were actually pre-mask, and now some research study is showing that the risk, if everyone is wearing a mask in the aircraft, so reducing the chances for person-to-person transmission is even reduced. What the importance of that, even in business aviation, and we're going to comment on that, is because sometimes you need to reposition people, sometimes, and you're still dealing with the overall fear of traveling, thinking that the airplane per se is a risk, although we are not negating that there is a travel-related risk, but probably, and thanks to this, supported by those statistics and the studies, we have very strong reasons to believe that this is the plane per se is not the highest point of risk. Actually, quite the opposite. It seems to be a very low risk environment for the transmission of this virus, and other virus, should I say. So what we believe, and that should be put in place, is, we are all familiar with the Swiss cheese model, is exactly the same thing. The only problem here is that in our Swiss cheese here, the holes are quite big. So, and therefore we need to have multiple layers, multiple slices of this Swiss cheese in order to really put a system in place. However, then that will include personal responsibilities, and then shared responsibilities, governmental, public health responsibilities. So all together, and this is the exact same model that we believe can help in that matter. So, and how do we do that in the aviation environment is, again, in a multi-layered approach. So in which you can have, and you should have, measures that are taken pre-flight, then in flight, and at destination. So for example, pre-flight, you need to understand the passenger health before boarding, because of course, if you have a system in place that is able to capture suspected cases before they get on board, then the risk of transmission is even lower, right? So now, and this is accomplished by having health screening at the airport, sometimes questionnaires, crew health protocols with screening and testing programs, crew training about how to identify those cases and how to escalate the situation, social distancing and the use of PPEs, travel declarations and destination risk assessment. So on that, I will ask John, would you like to comment on this bullets here, please?
Yeah, just very quickly. Thanks very much, and thanks for everybody's time today. As the doctor said, COVID has fundamentally changed some of the way that we view the world, and certainly the way that we're traveling. And so as we've learned in our business, not just only from a health perspective, but from a safety standpoint, it's absolutely critical to do due diligence and understand where you're going and what those attendant risks may be. So that's why we recommend making risk assessments no matter where you're traveling to. If it's a single destination, if it's multi-leg, understand what sort of training your crew and potentially even your passengers may need to understand the threats and frankly the risks that are associated with those locations. And contingency plans, everything in this day and age, whether it's ERP related to your operations, to understanding what those location threats and those risks are, it's always prudent to think through how can we establish the right level of planning so that we can think through in this day and age where with COVID, things have become so volatile and so uncertain. Plans are certainly a good way for us to help start think through what are the things that we can do in the event that the problem arises and we need to take action. So back to you, Doctor.
Thank you, John. So yes, the next layer will be then the in-flight phase of our multi-layered approach. And it's essential for us to understand, the symptoms and the suspected cases and how to handle those cases, how to mitigate any risk if, a case is identified or suspected on board with, what are the clinical aspects? How could we help and to isolate that person to limit, any possible transmission inside the aircraft? How to correctly use the protective personal equipment. So, and also how to, because it's a fine line where you don't want to overreact and you don't want to overreact. Therefore, you want to contribute with the public health authority, and therefore you need to critically and very accurately identify those cases that are reportable to the public health authority in the receiving airport. So what is the adequate equipment, the face coverings that you need to have, social distancing practices, not only, boarding in and disembarking the aircraft, and of course, how to handle the service in order to diminish the risk of exposure that. And then at destination, the coordination of medical attention of the cases so identified, the crew and passenger precautions at destination. It's really interesting because in our experience, for example, when we cases that we helped in handling with crew members while they were away from home, they frequently identify the source of potential exposure as another crew member. So, and there is a very interesting study showing that the risk of you acquiring COVID-19 is actually almost similar if you are traveling with someone or if you have someone in your household. Because of course, when you're traveling, you have a very, how could I say, intense relationship with your travel partners. So another aspect is the disinfection of the aircraft. You don't want, and there is a recent paper from the FAA just mentioning that you just don't want, again, to overreact or to underreact and not clean the aircraft when appropriate and adequate, but you just don't want to use it too much at the risk of corrosion of material and other further damage to the structure of the aircraft. Of course, you need to be aware of entry screening and testing by the government of the local and health authorities. And also, John, could you comment on the intelligence and information about that as well, please?
Yeah, absolutely. And I think as most are aware by now, we're seeing changes in entry and exit requirements. And sometimes these changes are happening within a matter of 24 hours. So you may have done some of your planning, for example, and by the time you're ready to depart to your destination, some of that information has changed. So it's absolutely critical that you stay well engaged in this process. And whether it's traditional threat information, threat intelligence, or just general information, it's always good to have a trusted source. And we've learned that from time and time again, especially in the flood of information that we're seeing today. There's multiple sources. There's a plethora of information that's out there, sometimes contradictory. Sometimes you wonder if it's trustworthy. And so your ability to go through and do that due diligence again, and also have trusted partners to ensure that you're getting the right level of information so that you can make the right decisions to get yourself back into the air, back flying, and fundamentally get your business up and running again. Additionally, some of the things that we would also recommend if you're going to be staying overnight, cruise RON or whatever the case may be, ensure you understand where you're staying, what those lodging arrangements look like, whether it's a hotel or some other source. There are all sorts of protocols that various governments have in place, even localities down to that level. So understanding what they are in compliance with and what that particular facility is going to be providing you is absolutely critical to ensure that you've got a very comprehensive understanding of what's happening as you're out there going from location to location. And as we've seen also, our organization, our parent organization especially, we've seen the need for emergency evacuation services. And this could be medical or this could be safety related. And I think one of the fundamental things, especially in the COVID era, that we've seen from a safety standpoint is the attendant civil unrest in particular locations, various protests that are popping up. As Dr. Paulo Alves mentioned, there's a bit of fatigue that's going on. So people are getting frustrated. Second waves, third waves, these things are triggering various reactions. And those reactions, they may have implications for your decisions as you get into a particular location, and having various resources to be able to tap into and leverage, such as Medaire, in the event that there's a significant emergency situation, whether it's medical or safety related, is I think absolutely critical in this time. Thanks, Doctor. Back to you.
Thank you, John. So yeah, I think in the planning you need to to take into account a few things. So planning strategies and contingency plannings on what if a crew member or passenger will fall ill while traveling. What is the appropriate that have you made any modification to your even your office or staffing? Because remember, the health of your crew members and your staff is absolutely critical if you want to keep operating. You don't want them to to be contaminating each other. So, and do you have the right supplies? Are you are your crew adequately trained and prepared to identify and to handle those situations? All those considerations I think should take place. And on the safety side, back to you, John, I would like to comment.
Yeah, and it's exactly as the doctor says, and it's what I left off with, is taking a comprehensive view of this, because again, the world is certainly in a much more volatile and uncertain position than we were pre-COVID. And given the way that governments are reacting, sometimes very short notice, sustained lockdown periods, sometimes those lockdown periods can be much more stringent in one location as opposed to another. If you're not in full compliance, does that put you at additional risk? So understanding what's changed from one location to the next, again, potentially even within a 24-hour period. Looking again at the lodging facilities, do you have a full picture and an understanding of what the requirements are? Are they in compliance? Are they doing what the governmental authorities are telling them to do? And generally speaking, are they doing what the medical authorities are telling them to do to ensure maximal safety for your crew and passengers as they're seeking lodging, whether it's for a short period of stay or a longer duration? What are some of those practices that are in place for workplaces? Are you also looking at the overall climate? Is this appropriate for your business? How are you going to resume in this volatile and uncertain environment? And some of the other things that we're also seeing, and they could be related, and they certainly are important, is looking at overflight safety. Do you understand what those particular routes are looking like right now? We've seen a flare-up, for example, of most recently some of the geopolitical tensions between Armenia and Azerbaijan, a fairly important transit route between Europe and Central Asia and South Asia. Additionally, what we're seeing in the Horn of Africa region right now with Ethiopia, the what could rightly be called a looming civil war in that country. What are some of those risks as far as they pose to your in-flight and your operational aspects? And again, and probably most importantly, what do those travel restrictions look like in this COVID era, and your understanding of all of the information sources out there? Can they be trusted? Do you have a trusted partner? And do you have sources that you can rely on, especially should something change last minute or very short notice? Doctor, back to you.
Thank you, John. And so, in summary, I think it is interesting to put in place something like this, a return to operations checklist. So thinking about crew testing programs and protocols so that you can have guarantee the health of your crew members, implementing a crew and passenger screening process before the missions in compliance to whatever the requirements could be for in the receiving country, ensuring crew scheduling minimize risk in case of a positive COVID exposure. This is absolutely critical for them not to get trapped now abroad and go under quarantine and compromising your flight department. Considering is your medical kit appropriate? Are you carrying the PPEs and the screening equipment necessary and the cleaning supplies necessary for a safe operation? Do you have a trusted provider who can help you with any medical arrangements if case be, if you are abroad, how to coordinate that and finding the right place to send your crew member to be evaluated and sometimes to be treated, knowing that the hospital capacity could be compromised in certain destinations that you should again identify upfront. And now to researching your destination. You can continue from here, please, John. Thank you.
Yeah, absolutely. And just to summarize again what we've already discussed today, but we think it's absolutely important. Take a holistic view and a comprehensive view of what your overall risk looks like, not just from a purely medical standpoint, but what are some of those second and third order effects that may stem from this COVID pandemic and some of the issues that arise from it, whether they're governmental lockdowns, general panic, or other issues that may result in risks that may present themselves to your crew, your assets, and your business operations overseas. So ensure that you've got a good information source, ensure that you've got trusted partners, ensure that you're doing the due diligence to conduct those threat and risk analyses no matter what you're doing. Take a hard look and understand, are the places that you intend to lodge, whether it's a known hotel or some other location or facility, are they in compliance with what the government is telling them, and are they doing what the public health authorities are recommended so that you keep yourselves as safe as possible? And again, contingency plans I think are absolutely critical to include thinking through worst case scenario, what about evacuation options, whether they're medical or safety related. So with that, thank you very much. We very much appreciate your time. And Dr. Alves, if there's nothing else, I think we can take any questions, should there be any.
Absolutely.
Yes, sir. We'll hold for questions. We'll give it another 10, 20 seconds because we still have a little bit of time. That was indeed a very thorough presentation for both of you.
Thank you.
Thank you very much.
Okay, with no further questions, I want to thank you again, Dr. Alves and John, for your time joining us live from Arizona. Ladies and gentlemen, this concludes the first half of day 2. It's time for us over here in Asia to grab a bite for lunch. We'll see everyone back here in 1 hour for our next session on AsBAA and AsBAA. Thanks so much.
Thank you very much. Have a great day.
Thank you very much. Thank you. Have a good one.
Oh, there is a question that just came, Dr. Alves, if you're still available.
Yes.
Oh, that was for John. Let me see if I can get our team to get John back in here if possible. Wait a second. Okay, no worries. John may not be here with us at the moment, but Dr. Alves, this question can go to you. It was meant for both of you. The question is there a risk assessment in case the COVID virus mutates? That's it.
Okay, yeah, well, that's an interesting question. And I have good news, bad news, which is the virus is already mutating. And thanks to that, actually, we have a very good understanding on how, the migration of the virus, and for example, we know quite for sure that some cases in the East Coast of the United States actually came from Italy, in the West Coast more from Asia. So actually, it is mutating. However, thanks God, and that's the good news part of that is that so far the how could I say the aggressiveness of the virus, the lethality is not changing unfavorably. So although those minor mutations are enough for us to identify that different strains of the virus, there is no so far clinical consequence of that. And importantly also to add, if I may, is that all the vaccines, at least the ones that are approved now, they are geared to a certain protein, the spike protein on the virus, and therefore those mutations wouldn't affect the effectiveness of this vaccine.
Fantastic. Thank you very much for your response, Dr. Alves.
My pleasure.
I believe that's it. We will now take a lunch break here in Asia. We'll see everyone back here in 1 hour for our next session.
Thank you once again. Bye-bye.